the urinary tract, starting from this point, you know what is coming out from here is the pelvis into the ureter, then down to the bladder, to the urethra, and then out. So anywhere along that point is your what? Urinary tract infection, UTI, and it causes fever. I spent about 30 minutes trying to explain to my patient that fever is not malaria, because he was saying that fever is the same thing as malaria. So today I want to show you a lot of diseases in the body that can cause fever, which is not malaria. So fever is not malaria. So let's prove this, that fever is not malaria. Now check this out. Okay, you have to manage my drawing, no? I'm trying to sketch something that will represent the parts of the body so that I can show you a lot of things that can cause fever. I hope this image is clear. Now, fever can come from any part of the body that has infection. Now, if it happens on the hair, in the hair follicle, it is folliculitis. And it can cause fever. If it happens in the lining of the brain, that is the meninges, it is called meningitis, and it can cause fever. Now, if it happens in the eyes, that's the infection of the eyes, it could be conjunctivitis, bacterial conjunctivitis, and it can cause fever. Now, if it happens in the ear, it could be just otitis media. So this, let me just bring it to this point too. Otitis media. Otitis media can cause fever. Now, if it happens in the nose, it can also cause fever, and that is called rhinosinusitis. I don't know if you can see this part. Let me bring it back so my head will not cover it. Rhinosinusitis. So if it is in the mouth, it could be in the tonsils, and that is tonsillitis. Inside the mouth, you can see it from this diagram, behind the throat, it could be tonsillitis, or the pharynx, that is pharyngitis. And both of them can as well happen at the same time, and that will be what? Pharyngotonsillitis. Please pardon my space. Okay, now if it happens in the esophagus, that is what? Esophagitis. Esophagitis, and it can cause fever as well. Now, if it happens in the airway towards the bronchioles or the bronchi, that is bronchitis or bronchiolitis. So this is inside, you can see from this diagram. So bronchitis can cause fever. If this is a woman and the breast is affected, it can have infection, and that is what? Mastitis. mastitis in women only. Now, the organs inside the chest, if it is in the lungs, that is the pneumonia that you hear, bacterial infection in the lungs. So let's assume the lungs is somewhere like this, and remember it's on both sides. So you have your pneumonia. Now, if it is happening in the heart is somewhere here. The apex of the heart is there. So this will be endocarditis. Endocarditis. That is in the heart. Now, if you go down to the abdomen, so this esophagus comes down like this and gives you the stomach this way, which continues as the duodenum and then the other intestine. So if it is in the stomach, it is gastritis and it can cause fever. If it is in the intestine, it is enteritis, it can cause fever, and both of them can happen at the same time, and that is called gastroenteritis. Gastroenteritis. So one small stuff here. If it is in the appendix, of course you know what it is, appendicitis. Appendicitis. I think there are other organs I'm missing out. Okay, yeah, if it is the liver, which is somewhere here, it is commonly, hepatitis. All these things can cause fever, and the patient may not even have malaria. So fever is not malaria. We have not finished yet. Now, if this is a male patient who we supposed to have balls, infection here is what? Orchitis, and it can cause fever. Now in the female, it will be what? Ophoritis for the ovary, or pelvic inflammatory disease. Okay, yes, there is an organ we missed here, the kidneys, and that is a bean-shaped organ. This way, this is the kidney, should be on both sides. So if it is the kidney, sorry for the crossing, it is nephritis, pyelonephritis. All these things can cause fever, very, very high fever. Now, if it affects any other part of the urinary tract, starting from this point, what is coming out from here is the pelvis into the ureter, then down to the bladder, to the urethra, and then out. So anywhere along that point is your what? Urinary tract infection, UTI, and it causes fever. Now, if it is in the muscle, let's assume this patient's muscle has infection, that is myositis, and it causes fever. Myositis. Now, if it happens in the joints, let's assume the knee joint or the hip joint, infection can happen in the joints. That is what? Arthritis. And it can cause fever. Now, if it is in the skin could be affected, any part of the body. It could be any other skin infection, but let's just use cellulitis. So we have tabled down 20 causes of fever that is not malaria at all. So when you have fever, or when your child has fever, don't just assume that it is malaria, because it could be any of these. Okay? Thank you for watching this video. If you have any question, you can drop in the comment section. If you want to understand any of this, you can put in the comment section, so we'll discuss it later. Please share this video as well to create more awareness, and follow this page so that you can see more of my videos and other stuff. I shall see you tomorrow.